Okay, everyone, we are recording. This is our mental health webinar with Allison and Jill, and I am going to let them introduce themselves. And then I will help just kind of moderate and monitor the chat in case anybody has any questions or you need anything. If you don't want to unmute, feel free to type them in the lovely chat box and we will get those answered for you. And I'll let Allison take it away.
Great. Thank you so much, Amanda. So thank you for just allowing Jill and I to do this. I'm Allison Wilson. I am a psychologist in private practice in the Denver area and specialize in the area of fertility counseling and all that's related to that. I really enjoy my job, and it's an honor to try to help people become parents. I am a current member of Board of Trustees for the Colorado Fertility Advocates, and I'm also a Board of Trustees for Reproductive Alliance. And then I'd like to introduce my colleague and friend, Jill.
Hi, all. My name is Jill Penrovich, and I'm a psychologist. I've been in private practice for almost 8 years now, and then specializing in fertility for the past 5 years. Definitely feel passionate about working with this population. I myself am an IVF warrior. I am the proud parent of a rainbow baby, so I've also had those experiences as well. My son is 4 and my daughter is 2. I'm part of the American Society of Reproductive Medicine, Colorado Fertility Advocates, and Postpartum Support International as kind of my professional organizations and groups. And my spare time, if I have any, with a 2 and a 4-year-old is I like to work out a lot. I do a lot of CrossFit and yoga to kind of balance out the difficulties of this work and just my life. So there's that.
All right. So Jill and I thought it would be helpful if we went over really just common themes that we see in our private practice. And our hope is to shed some light. If you're a patient and you're experiencing some of this, you're not alone. And to know that it's very typical as you go through infertility treatments. And the first one that we'd like to go over is grief and loss. That time and time again, I'll have someone come in and maybe they're just starting to try to have children, or they're in the throes of an IVF cycle, or they've been in it for many years. But I'll emphasize just what a tremendous loss it is to have to go through this. It's not a glass of Chardonnay sex for a heterosexual couple, and for other individuals or same-sex couples, it's even more. You have to go through this. And with any type of loss, we humans tend to go through different stages of that. And usually there's some shock or denial at first when you're first experiencing there's a problem. But unlike other losses, I think fertility-related losses is unique in that it's not quite resolved yet. It's often, do we buy the minivan? Do we not? It's waiting for that. There's the loss of innocence. It isn't so easy to have a baby, or if you get pregnant, to keep the pregnancy, and that can be difficult. Other losses are hard as well, like a death or a divorce or a move. But with those, like I'll tell clients, you might get casseroles from others, you get a lot of support, but this is pretty private, and it's really hard on an individual and a couple. There is that loss of stage of life. Didn't think I was going to be here. All my friends have children and I don't. And the loss can be far and wide. And so, when you are experiencing that, and Jill and I will talk a lot about what can you do, but one is to acknowledge and validate that this is a loss. And we know from research that fertility is a life crisis, going through infertility, and it's important to recognize it as such. But yeah, Jill, I know you have a lot to add to it too.
Absolutely, I was waiting to jump in. There's so many different layers that you're talking about. One is that, I mean, one of the reasons I'm here today is because I want to provide more education to people, because people don't talk about fertility treatments. It's a very lonely thing to go through for a lot of people, or a lot of the clients that I see. And you're right, it's not the same as something so concrete as losing a loved one, where people kind of show up into your life. And oftentimes this is ongoing too, where it's not just a one-time event either. It can be a very long journey. So people don't quite understand that maybe in their lives, when to show up, where to show up, how to show up, or people don't even know how to talk to other people about this either, to be able to have that kind of support in their lives. And there's just the cumulative effect of multiple losses that are occurring throughout this. I kind of think of it as like past, present, and future way too, but there might have been miscarriages, or not be able to get pregnant for years before they even seek out fertility treatment. And then, as we all know, fertility treatment doesn't always go as planned, or the way things just come up along the way. So it's a loss of time for a lot of couples, because I have a couple clients 3 years into fertility treatments. They were like, I was supposed to be in my 20s having kids. I'm already in my 30s. How much longer is it going to take until I can have a baby? It's like this loss of innocence too, because they thought, oh, I've been on birth control my whole life. I'm going to go off of it. I'm going to get pregnant in a couple of months. And it doesn't quite happen like they thought it was. And then you kind of touched on this one too, a loss of identity, where they just don't fit in anywhere, because they want to have a family or build their family. They want to have children, but they don't quite fit into that crowd. People that already have children, or the people, they don't kind of know where they fit in with their friend groups anymore, because they're trying to have a baby and they just don't really feel like they belong anywhere. And so there's kind of this loss of identity, or also loss of friendships too, where people don't know what you're going through. You don't reach out to them. And then all of a sudden your kind of relationships suffer from this, your intimate one, your friendships, those kind of things, those kind of losses. And then, if you are not successful, there's all this future loss of not being able to live your life with a child too. And so hopefully it doesn't get to there, but there's also that as well.
Right. And even adding on a miscarriage or a pregnancy loss, and that is a whole other, pathway of, and I find it very cruel if a couple individual goes through treatment and only to have the miscarriage. And I talk about what an emotional whiplash that is to experience that piece of it. I also, when I look at losses, just like you said, it's like I will tell clients, if I were to throw a pebble into a still pond and that ripple effect, there's rings of losses and hurt, loss of your body, what you thought it was going to be, right? If there's any sibling rivalry before, wow, there's sibling rivalry now. Who's going to give grandparents, make mom and dad grandparents, finances, your marital, or relationships. It's just far and wide. So we're both here to say that is very true, and we can affirm and validate those feelings for sure. So
I would say a loss of ability to plan
Oh,
too.
yeah.
Because so many people, top of COVID, but also this, that, do I plan the summer vacation? Am I going to be pregnant by then? Just like you said, do I buy the minivan? Do I build the new house? Do I, it's just this, it's a loss of, I think the major thing that we're going to talk about too is just loss of control. It just, almost every single topic, touches on that too. So
for sure. Yeah. And so I don't know if you want to take the next one, or if you want me to.
It's okay. You reversed the order that we went through this, but it's fine. I can jump right into it too. So depression and anxiety is kind of our next topic. And so fertility treatments are really, really stressful, and going through infertility can be really, really stressful. So I think if anyone has a predisposition to having some depression or anxiety, it's not definitely, but most likely going to exacerbate that or bring that back up. And so because there's so much uncertainty, because of the hormones, because of the stress of it, because of not knowing the outcomes, definitely can up those kind of symptoms. And so, sometimes people need to go on medication, and that's okay too, like, to consult with your doctor and come up with a plan, or maybe you're already taking something and you're going to have to increase that. I always try to talk to clients like that have these pre-existing kind of things, like, let's come up with a plan before you even start treatment, because let's kind of prepare or do that. And I think, what the research says is the longer that you're in treatment, the harder it is psychologically, which would make sense. If, I have clients who it's like they're going through their first cycle and they're super hopeful, and I tell them, well, there's a chance that this could be really traumatizing to you. They almost like look at me like oddly, but if you've been in it for 2 years, if you've had failed transfers, you've had multiple miscarriages, this stuff can get really, really hard. And so and I also talk to people about how this is compared to a cancer diagnosis infertility is, and people that's like a really hard one to grasp too. But it can be as psychologically traumatizing as having a kid going through cancer treatment because of of all the unknowns and wanting a baby so badly and having the losses and all the things that are kind of unexpected that can occur along the way.
I agree. And when I think about anxiety, anxiety is always future focused, always. It is something you are not just worried about, but anxious about. And it's a threat. And we humans, baked in our DNA, is we need to look out for threats. And this may not be a saber-toothed tiger coming at you, but it sure is a threat of not being able to be a parent, possibly. And that can be terrifying. And so you start to go down the what if. What if this doesn't work? Or what if I never become a parent? And going along that way. And that's where I really think it's important. We're going to hammer this point home to get support, and be it through a support group, be it through a counselor or someone you trust, to talk about that. And I know when I work with individuals in counseling, well, what if it doesn't work? Well, I will share, finish your sentence. Then I will, we'll figure that out. But that anxiety is just palpable. Then we look at going through, let's say, an IVF cycle. We are pumping your body full of hormones for the female. And we know that hormones are related to neurochemicals, and they kind of go hand in hand. And so we're kind of throwing that off. And then on top of everything, we're going to take away all your coping mechanisms. You cannot go run. You cannot go lift weights for a while. You cannot drink a glass of wine, unwind. So that's also adding to the anxiety, and not to mention needle phobia or the procedure itself. And then, for some who've had losses, it's not just getting pregnant, it's sustaining the pregnancy. And that I see a lot of anxiety around that aspect as well. And at the end, after we go over these topics, we will share some strategies on what can you do for that anxiety. Yeah.
Yes, and people will tell them to just be hopeful, or it'll work, or just don't stress
You're thinking
out,
about
relax.
it too much. Yeah,
yes.
And I agree.
It's just normal. Anxiety is normal. I just had the conversation with a client today. It's normal, but when it gets, there's a Yerkes and Dodson curve. So when it gets too much, then it starts to impair us. But it doesn't mean that we care, and it is a normal part of life. But yes, with fertility, by far, it definitely raises people's anxiety. And I always say there's a threshold of where people, the last time they got to like their mark. So it might be like the 6-week ultrasound where they didn't see the heartbeat, or maybe it was the miscarriage at 8 weeks. And so, getting pregnant doing the fertility treatments is stressful and anxiety provoking, but then they're also, crossing another threshold in their life where they need to get past this point of where they didn't before either. So
right. Another theme that we briefly touched upon is phase of life, and feeling left out. I think I will hear it the most that there's this club of parents or mothers or mommies, and I'm not in it. And it's incredibly painful because no matter how many resources you have, be it financial, emotional, whatnot, we know from research, people will stop fertility treatments not because they don't have the resources, it's the emotional stress that is the reason why. And that phase of life, you're with your cohort, and we live in a reproductive world, and that's not going to stop anytime soon. So it is your job, be it with a couple or yourself or with a counselor or a friend, how do you navigate that? how do you navigate it? Because the world's not going to change, but you've got to learn how to cope while you're in this holding pattern and hoping, to have a child. And that, again, feeling left out. If you've had any prior losses in your life, infertility has a way of bringing all those losses full forward. And I think a lot of clients of mine are baffled, like, why am I thinking about that? Well, it has a way. And if it's a reproductive trauma, every cell of your body remembers that trauma. And so, it's coming out in that way. But we definitely see just that phase of life issue. Yeah.
I'd say, I think almost weekly with my clients, someone will say, guess who I found out who's pregnant?
Mm-hmm.
It's their sister-in-law who tried,
Yeah,
wasn't
yeah.
even trying, ovulated through birth control, or their coworker, or it is a lot of times where your peers are also in the same phase, in this phase of life where they're trying to conceive as well, and a lot of them are getting pregnant. And so part of my work with my clients too is like, how do we handle this? How do we navigate these situations, and validating those feelings of, whatever it is, of, anger or jealousy, or it's not fair, or those kind of things, whatever, may come up for them. And then also during this phase two, people are asking them to plan their baby showers when they're struggling with their own infertility treatments, or going to baby showers. COVID's a little bit easier because a lot of it's Zoom now. It's not as many in person, but when they're in person, do I go, or do I share with people that I'm going through fertility treatments, so that they know, or how do I handle this with people? But many people in their life are getting pregnant, and that's really difficult and can be really triggering too, depending on how those situations are handled.
I agree completely. Yeah.
So our next topic is, how could we have this talk without saying something about COVID? COVID, I mean, it's 2 years of it. I can't imagine doing fertility treatments during this pandemic. I did them, a couple of years ago, had my daughter right before the pandemic hit, thankfully, but God bless anybody doing fertility treatments during all of this. My God, it is stressful enough, yet alone being able to navigate all these extra challenges. I hear from clients even now this week, how safe should I be? I'm about to do an egg retrieval. I've had a client who her egg retrieval just got canceled because she tested positive for COVID. Another client, her transfer got canceled because of COVID tests. Clients are, canceling their trips to travel because if they get COVID, it's one thing to get COVID, but then when you're paying for your fertility, you've put your body through a lot. You've already waited this long. I've already waited so long. I can't possibly have this pushed back any farther. But then you're going through this and you're already lonely and isolated because maybe you're not even telling that many people you're doing fertility treatments. And now you're not going to go out to dinner with your friends on Friday night because you're worried if you do that, so that you're going to get COVID and everything's going to get canceled. And so people are just negotiating and trying to compromise and figure out how to manage this and what to do. And, and then again, it adds that layer of who do I tell and how careful should I be? And, and then also with their spouses, maybe having differences of opinions about what that looks like too, because then if they get it, then they're probably going to give it to them. And and this whole year, I think people in general have felt like they just can't plan their lives, or feel like we're all out of control and not sure what's going to happen, right? And so it's a parallel process, I feel like, that's occurring at the same time, and either one of them is just too much. And so to do both at the same time, I just think is just incredibly overwhelming for people.
I agree. And for many, depending upon the clinic, depending upon if there's a spike in cases, your partner cannot be with you during certain aspects of the treatment. And that is devastating as you go through it. And to have it, like I always say, hurry up and wait. That's in every clinic I've ever been affiliated with. It's just that hurry up and wait. Well, COVID just added another layer to that. I also think about we humans were not designed to communicate with a mask all the time. And you're going through such a personal, intimate aspect of your life, and it's already intrusive enough. And then you're telling the nurse or doctor, with a mask on, and how isolating that can be. Certain clinics, you have to be vaccinated, and that can be a stressor if that's not in your belief system or not. It just adds that added layer. And I think this really rolls into being out of your control. Like Jill said, you're dealing with it simultaneously. Infertility, obviously, it's not big picture, it's not in your control if you're going to succeed in having a baby. COVID, not in our control. But I know when I work with clients, I really look at, well, what is in your control? And, big picture, no. Little picture, what is? And, helping to figure that out for each individual.
I think you made a good point too. Well, I mean, in the past, because people have often felt disconnected from their partners. And so I've always encouraged people to have their partners included as many appointments as they can go to, and,
right.
Maybe gave shots or just be there. And with COVID, that hasn't always been a possibility. They can't take their partners to these appointments. And so I think it's created even a bigger disconnect in people's relationships because of that barrier of not being able to do that.
I agree. I agree. And at least earlier in the pandemic, there was a lot of fear of what does COVID do if I'm pregnant, and how will that affect me? And, we're finding out more things. And I always point clients to look at ASRM, the American Society for Reproductive Medicine's website for research-based, fact-based information to help, go through it.
Oh, yes. The vaccine debate is the other big one. And that comes up for clients too, about should I get vaccinated? When, is it going to impact my treatment? Should I get vaccinated after should I get a booster when I'm pregnant to protect the baby? Or will it, if I have a miscarriage, will I blame the vaccine? So yes, very important to talk to your medical treatment team about that and have reliable sources of information to make those decisions.
Right. I think another area that both of us see is that how long it will take to actually, at the end of the day, hold your baby. And that part, when Jill and I were talking about this webinar and saying, if we had a list of what you wish you knew before you started, that was the top one of how long this will take. And I think for many individuals or couples, it's, oh, okay, I'll go to the OB-GYN and surely they can do something. We'll take Clomid. And then that's not happening. And then, oh, okay, I've been advised to go to the fertility clinic. And, oh, okay, it's a medicated cycle. And then it's, oh, no, okay, now it's an IVF cycle. And then you think modern medicine, that's going to do it. But oftentimes it takes more than one time of a cycle to succeed. And so that part, I think, is so frustrating and stressful for anyone going through this process of just really how long it takes and how your life is, feels like it's put on hold for months, sometimes years, often years. So. Yeah.
And we know with fertility, age makes a difference. And so let's just add that to the stress factor. So not only is it taking so much longer, now I'm a year older, and I know that treatment outcomes do not get better with age. They get, the younger you are, often the better outcomes. And so just that, just that probably having a timeline might be good, but be flexible with that, because I hear clients time and time again that said, I was planning to be pregnant by the end of this year. Or my clients this week were saying, I want to have a transfer by the end of spring. And oftentimes too, the things that I would say too, like the things that people worry about are not the things that happen. It's like these things that always just catch them off guard, where they have to have a fibroid removed, or, there's scarring that they find, or something just, they ovulate through the birth control that they're on to stop their, something comes up that they just weren't planning. I mean, it just catches them off guard all the time because they think they have a timeline set. And, I tell people, if you can just try to be flexible and kind of not try to control everything, because especially with fertility treatments, there's not a lot of control. And then also too with that, you hear people who say, well, I'm not going to do IVF. I'm going to do a couple IUIs and, that'll be good. And then they don't get pregnant, and then they're at another fork in the road, and then they're like reconsidering their options again. And, or they're doing multiple IVF cycles, and they're like, I would never do donor egg, or I would never do gestational carrier. And so I think that it's a lot of reevaluating, their values and what they're willing to do and what they're not willing to do, or what sits well with them too throughout all of this, which can cause a lot of anxiety, and again increases the time that things could take if you have failed things and then you're moving on to the next one. But how many times we heard like, I would never do that, and then all of a sudden they're doing it because they want a baby so bad that they are willing to stay in treatment. And we know that meeting with a mental health professional actually can help you stay in treatment longer, because we help you manage the emotional effects of going through fertility treatment. So that is one of the benefits of seeing a mental health professional during these difficult times, is to help you stay in treatment longer, so therefore you're more likely to get pregnant if you're willing to stay.
True.
So I kind of touched on it before, but it's such a vulnerable population. I mean, that's why I'm so passionate about it, and having people really work on people advocating for themselves. But kind of, how do you handle others? This comes up a lot too in my work. One often is, what do I tell my employer? Because people have to leave. One of the things I wish I would have known before I started my own fertility treatments is how much time it took and how much time I needed to be at the doctor's office. I used to schedule people at 8 a.m. and I'd schedule all my labs at 7, and I'd be racing across town to try to get to work for the day. And that was so stressful. So I always talk to, when people ask, well, should I tell my boss? And I would say, well, how might that benefit you, or how might that hurt you? Because, we need to make sure that we're not increasing people. We want to try to decrease people's stress, not increase. Will your boss be supportive? Are they understanding? Is there any other thing about telling them, if you're in a same-sex relationship or something like that, would they use that against you, or could your job be threatened or something like that? I just want to make sure that people are in a good situation. And so that always comes up. Should I tell my employer? And I hope that they can, because you are going to, people have a lot of appointments they're going to need to go to, or things happen last minute all the time. That was the other stressful thing, where the doctor's office calls you and say, you need to change your medication. You need to run to the drugstore and get it before they close it at 5 o'clock, or come to the clinic and pick something up. And so if your employer doesn't know that, then they might think, what is going on? And again, I think it helps to maybe remove the stigma about fertility. It is a medical diagnosis, infertility. So, it should be viewed in our society that, people need to go to a medical appointment, and that they should be supported. And that is how I feel. And so there's that part of it. There's, the friend that asks you to throw their baby shower for them while you're in the middle of fertility treatments. How do you respond to that? Or how do you respond to a baby shower you're asked to go to? And, we just kind of talk through that and see, like, different people have different ways of handling things. And you don't want to keep missing out on your life either, or not have these relationships because you're going through this either. That's kind of isolating and lonely. So trying to figure out what the middle ground is, what feels right for them, how they can navigate this, who's going to be supportive to them. And then the other one is people will say, oh, you guys have been married for 5 years, you're not going to have kids?
Yeah, exactly.
And people are like, oh,
exactly. Yeah.
And so how you handle that when others say things just offhanded, or, you're trying to get pregnant and people give you advice, just to relax or do yoga. Someone told one of my clients recently, just do some yoga. They're like,
or if you just adopt, then it'll happen.
Right. All these little helpful tidbits from other people. So how do you navigate that? How do you still maintain relationships? Maybe how do you educate others, when you're in a good place about, how to say, or what would be helpful. But relationships are so impacted by fertility treatment in, good ways and bad ways. I think, it can go either way.
And I agree in that. as I mentioned earlier, that ring, of in a pond, one of them is how to handle others. And I think one of the most painful questions a person can receive is, do you have children? And it seems a benign question. It's what we do. But if you're going through that, or experience it, or a loved one, that's a loaded question. Do you have children? And oftentimes clients will go, oh gosh, I don't know how to answer that, because I don't want to appear like selfish, or that it's all about me, or I didn't want children, but I desperately do. And so I will help to coach, like, what can you say that feels meaningful? Of, oh, we very much want children, and that implies that we're trying. And I agree with Jill in that you need some support, but you have to be careful of who you share this with, because it's very vulnerable information. And I wouldn't want someone to just throw this all over the place, because someone can hurt you with it in some sort of way. So I always advise people, who's in your support team, who's going to be there for you, but more importantly, who has earned your trust. Because we know from research from Brene Brown that vulnerability, we need to share it to kind of release shame, but we need to share it with somebody who has earned our trust. And so figuring out who that is. And I think another painful aspect of how to handle others are parents. They mean well, but I will hear a lot of pressure from the in-law or the parents of, when are you giving me that grandbaby? And some couples or individuals haven't shared quite yet the struggle, and others have. But that's like a pressure that they go through, and very, very hard too. And so again, a coping strategy, is figuring out, what words do you want to use that's fair to you, and educate this other person, be it a loved one, because a lot of people don't know what this is. And so a lot of people, especially loved ones, don't know how to handle it when you're in pain. And so I will often tell clients, how you've been grieving over, you were kind of surprised it didn't work, and then you're angry, and then you're wondering if it will. Guess what? Your parents do too. It's extremely painful to watch an adult child have difficulties conceiving. And as a parent, we don't know what to do. We want to bubble wrap our kids. Even if you're 30 years old, we still want to bubble wrap you. And we don't want you to go through that pain. And it's difficult if your parent, your mother in particular, never had infertility, but you're the daughter who does. There's a disconnect there. And so your job, though, is to figure out, how do I handle this? And each family is very, very different, and kind of figuring that out. I think too, if we look at gay individuals or same-sex couples, trans persons, there's another layer. Who do you share this with? And it's vulnerable information. And I wouldn't want you to just throw it out there to be judged or analyzed or penalized. No, it needs to be somebody that you trust as you go through this process. But I thought it would be helpful with the remainder of this webinar to kind of go back through each one of these themes that we, or the majority of them. And Jill thought we could give some tips on what would be helpful, for people. And yeah, if you want.
Well, I'd say, I believe in prevention. So it's really hard when somebody is in crisis mode to really do a lot besides just talk about like what is there present. When I have clients that come in session, they're like, nothing's going on. I'm like, great, let's actually do some deeper work today. So for even when I was doing my own fertility treatments, I started seeing a therapist before I even started, because I just wanted to have somebody in my life that I trusted, that already knew who I was. I wasn't just going to jump in when things were just really, really rough. And so I think that's just helpful of kind of, if you do have the foresight to know that you're going to go through something, kind of maybe trying to figure out who is your support system, who can I talk to. There's also support groups that people can join as well.
Right.
Sometimes they're offered through fertility clinics, through Resolve. There's different groups around the country. Things are a lot more accessible now through telehealth. And so maybe that, and that's even difficult too, because this kind of goes back to some other topics. Sometimes people just don't fit right into those either, depending on what's going on.
Right. And I will tell clients with support groups online or whatnot, I don't want you to leave it feeling worse than when you got into the group. And sometimes that can happen where, the participants are just beating the drum too hard, or they're sharing too much and it's overwhelming. And so that support group's not always the right one. It might be individual or couples counseling, or finding a trusted friend or advisor that gets it, that just gets it. I think with the grief and loss, in my opinion, we live in a culture that's not very comfortable with grief and loss. Most people don't want to feel that, and loved ones want to make it feel better. We want to fix it. And so finding that unique person to just be with you and hold that space for you is immensely helpful. And usually it's a therapist, but it could be a friend who is not going to fix it, analyze it, judge it, it just swim in those deep waters with you. And that can be healing in and of itself, because you are understood and your feelings are validated and you are not alone at all. A counselor can help to figure out your prior losses and how that's coming into play for this loss, and lend perspective on that piece of it.
I was going to say too, some people rely on faith-based leaders as well. So it doesn't have to be a counselor. Sometimes there's somebody, they have strong affiliations to that community, and that's really helpful for them too. But yeah, absolutely having support. We know that when you have someone to process with, your outcome is just going to be better than trying to do it all by yourself. I mean, this is just too much weight to carry for one person. I think too, the other thing about more like thinking about heterosexual couples or relationships is that oftentimes two people cope differently.
Yes.
The man and woman, not to stereotype, but typically, men often want to fix the problem or solve the problem, right. and then women need more of the emotional support. And not to say that that's not always the case, we know too. So maybe the husband thinks he's coping by, I don't know, working more so that they can pay for treatment.
Right.
But the wife feels like he's never home or not there to support her, but she doesn't recognize that's how he's coping actually with it. And so just making sure we have good communication skills and with our relationships too, to be able to actually talk about what our needs are, and getting them met, and making sure that you're communicating the entire time through treatment. Because I feel like with anything that's traumatic in life, it can destroy a relationship or make it grow stronger. And when I work with my clients, it's always to make the relationship grow stronger, because of what they went through, not that they're going to fall apart because of everything that they've gone through.
Couldn't agree more. People approach this very differently, and there are gender differences. We know that from research of how they handle it, and how do you stay connected as you go through it? The good news is research also shows that most couples do survive going through fertility. And I think a lot of couples, when I see them, they're like, oh God, this is going to ruin our marriage. And, we find it doesn't all the time. And it's more working as a unit. And I will tell clients, I want the infertility over here, and I want your couplehood united here. I don't want the infertility to wedge between you two, and kind of help them and give them skills to do that. With the depression and anxiety, if you are a patient that's going through a clinic and you do have that history, uh, as we mentioned earlier, symptoms can come back. And I think there is a lot of fear about, oh gosh, maybe I can't do a cycle if I need to be on an antidepressant or anti-anxiety medication. I'm certainly not an MD, that's not in my scope of practice, but I do say, talk to your RE, your reproductive endocrinologist, because we're all on your side. And I really view this as team baby, and I'm in that team to help you bring this little one to life. And your doctor is the first person to talk to about that, and they can see what could possibly work for you. There are many infertility patient women that are on a medication, a psychotropic med, and still go through. We also want to be really mindful if you have that history, not only when you're going through fertility treatment, but postpartum, and being very vigilant on, seeing if those symptoms come back. And that's where, like Jill said, you want to be more proactive than reactive. You want a team of support, be it a mental health professional, your doctor, your nurse, or whoever, to help you during the cycle, during the pregnancy, and then also postpartum, especially if you have that history.
Yeah. Well, I think part of the coping strategies too is, how do you still find joy during this time, COVID and fertility treatments, right? Like, what are the things that make that fill you up, that make you feel good? What are the things that you still can do if you can't, work out? Can you still go for a walk? Can you, spend time with your loved ones or your dog, or what actually makes you feel good? And just trying to do more of that, because it is such a hard and stressful time. And you don't want to completely lose yourself in all of that. And often, people have breaks where they're not doing anything. And it's like, okay, what can you do during that time that might give you a little boost or make you feel good again? Because if you have to go back into another cycle, it's so hard. You had something fail to kind of pull yourself back up again. So we really have to try to refill ourselves, and do some things that actually make us feel good. Or, people want to travel or go on vacation. So, what does that look? Can we figure out a way to make that happen? Or maybe we don't go to Europe right now. Maybe we try to figure out something a little that can still bring happiness, but not cause stress too. So
I agree. I remember years ago, a client was, we called it a holding pattern. She was, between cycles, and there was a delay, and it was going to be a couple of months. And we looked at, what can you do during this time period where you didn't deserve to be in it, but here you are? And what can you do that has nothing to do with your fertility status at all? And I clearly recall her going, I'm going to get a pair of leopard high heel shoes and walk around the house. It was things that she probably won't do when she's a mom of a newborn, but it's things like that, of finding joy. Because I think going through this, you're incredibly vulnerable, and you so want a baby, and I understand that, and you will do anything in your power. But if I told you you have to hold your arm up for 2 years and then you get one, hell, you would hold your arm up for 2 years, or as long as you could. And so again, talking to someone who's been through it, or a professional or whatever, can help lend perspective that big picture, again, this is out of your control, but I will help you to look at what is in your control. And that is one of the things. We can go on a picnic, we can go do this, that type of thing, is what is in your control.
I will also validate clients, because especially in Colorado, where people are very much into physical fitness, that nothing replaced being able to slam down 100 pounds or something, where they take doing fertility, they take away most of people's major coping mechanism, which is some type of level of physical fitness. And so maybe sometimes our work is trying to come up with other ideas of where they can put their energy into until they can do that again as well.
Exactly. And I think another good coping skill, regardless if you see accounts or not, is I'm a real big fan of journaling. And we know from research that writing, I prefer pen to paper because it helps, it's rhythmic, it helps with anxiety management, can be very therapeutic, can be very cathartic because it allows the brain to go, what is it that's bothering me today? And putting it into words does something in the brain to help process it. And so, you know, if you're just starting out on this journey, or you're in the middle, or gosh, you just finished, journaling is very, very helpful. And we know ideally 15 minutes, 20 minutes at a time. But I get people are busy, and so I'll tell clients, all right, it doesn't have to be all that, but allowing a safe space to write. And clients will often worry, you know, well, what if someone reads this? So I'm like, rip it, shred it, burn it. I don't care what you do with the entry. It's the act of writing that can be very therapeutic to help you.
I like to point out too, so it's writing across the pages, right brain, left brain.
Yes,
and so that is why you're able to process information. And so blogging is good, but you're typing, and so you're not actually you're not processing the information as well as actually if you're writing it out. And I always thought there was something to that, and then I finally read research on it, and I was like, yes, I knew there was something about writing over typing and blogging. So yes, very therapeutic to, it's just another way of processing it, of the information.
Right. And then, you know, how to handle others. I don't think you owe anyone an explanation, but I would have something ready to say that's non-defensive, or you've prepared, so you've rehearsed it so that when you're caught off guard, you know what to say. And so, you know, like I said earlier, do you have children? You know, well, we really want them. That implies, or some people want to say where they're at, and that's fine too. But have that ready to say in advance, I think, can be very, very helpful on navigating it. Also, like with baby showers or christenings or things, if it's somebody that you know and you trust and they know what you're going through, they'll understand if you're like, I just can't do this right now. And if it's someone you don't know that well, point and click and send the gift. It doesn't mean you're an evil, jaded, angry person. It just means you're going through a really, really hard time right now. And to be very, very kind and gentle to yourself as you go through this life crisis.
Well, it's a way of taking care of yourself, of not putting yourself in the position to be asked those questions when you're having kids, or those. Sometimes you just are not in a place that you're able to handle that, and that's okay. And so send a gift, show, you know, do something that shows your care, and move on with life. The other one I would say is mindfulness practices for coping strategies to help with just in general. They're just so great to help with stress, anxiety, depression. And so those can look like a lot of different things. I always joke around with my clients, I give them a buffet. We lay out the buffet and then they pick and choose kind of what I give them a whole bunch of different things, but it could be, you know, working with your 5 senses, or doing grounding exercises, or deep breathing, or progressive muscle relaxation. Yoga is very, very good for stress reduction. We know there's tons of research on that. Meditation. So people are always like, tell me, I suck at meditation. I'm not good at meditation. I said, okay, how do you meditate? They say, I try to sit quietly for 5 minutes. I said, okay, that's fine, but that's not the only way to meditate. You could do a walking meditation. You could do a guided meditation where you listen to something. The coloring books, I always joke around, I don't know why they call them adult coloring books. I don't know if they're dirty or what, but they always say adult coloring books. We know that coloring is meditative in that whole area of neuroplasticity where we see, you know, the gray matter growing in our brain, and the neural connections and everything growing. And so if people don't want to sit there quietly, they can color, and they're going to have really good benefits from that too. And so, you know, I try to come up with a plan that's going to make my clients successful. So, you know, maybe they do 10 deep breaths first thing in the morning. Or for me, I meditate at night because I'm not good at doing a lot of things in the morning to get myself out the door. And so that works for me. I know people say meditation in the morning is better. Yes, it probably is, but we try to come up with something that works for them.
Right. And I know we have a few minutes, but Amanda, I didn't know if there's any questions in the chat. If not, So I did want to point the audience to actual resources, and one of which is Resolve, which is a national advocacy group. And Resolve often offers support groups. They're online, a lot of them now, but they're peer-led, some are professionally led. And it can be very comforting to be in a room or a chat where there's people who get it, and that's a fabulous resource as well. The American Society for Reproductive Medicine has a whole section for patients, and they are kind of like our governing board, if you will, on fertility treatments and clinics, and what is good standard of care, and seeking that out. And they have different resources online as well. I know there are therapists on this call that offer also support groups, and be it through clinic or through the community. But just finding that, again, can be very, very helpful. If you're wanting to work with a counselor in this area, I think it's important to work with someone who has specialized training in this field, because I've had many clients that will come to me and go, my last therapist was awesome. She was sweet. She was great, but it was annoying. I had to explain what IVF meant or what this meant. And I spent most of my session doing that. I don't want to do that. And I get it. So if you go to, again, the ASRM, or American Society for Reproductive Medicine's website, you can click on and find mental health professionals that are trained, that are in your community. And that can be really helpful as well. Didn't know if you had any other resources, Jill, you wanted to add to that, or?
Well, I mean, I'd say everyone here is probably part of Colorado Fertility Advocates, kind of just knowing what's going on locally, or how to get involved, or how to become connected. And then, just at your fertility clinic, ask them for resources. They have them. They have lists of providers. They have oftentimes support groups of what's current, and things that are kind of have changed a lot since COVID, because there used to be a lot more support groups that were in person that I knew about, but a lot of it now is telehealth. So.
Yeah. Well, if there's any questions, let's see. I think, yeah. Oh, thank you. So yeah, Amanda put those up on there for the different resources. And then, yeah, last thing too is do check back on this website for Colorado Fertility Advocates. There's webinars on various aspects of it, and this year's board is doing a really good job to try to present different topics every other month. There's a big legislation push to make sure that we do get fertility coverage through insurance companies. And so please advocate, please keep tabs on that, and by visiting this website as well. But outside of that, there's no questions. I really wanted to thank you for allowing me to speak, and Jill, I enjoyed it as well. Just sharing our knowledge.
Yes, thanks for having us. And I'm sure we could talk for hours and hours more about all of this, but hopefully just kind of the main point really is just things are out of people's control, and just to validate, the difficulty of this experience. So, that it is really, really hard.
Great. All right.
Thank you both so very much. And I will go ahead and stop the recording.
All right. Thank you.